Hello, I'm Dr. Sarabone. Welcome to Yodo. This is a place to learn about topics related to serious illness. I'm recording this information for November, as a specialty of hospice and palliative medicine are celebrated during November of each year. I will provide information related to patient and family concerns that leads them to palliative and hospice care. This extra layer of support is a medical specialty, and it's trained to give and provide for symptom management and assist patients and families to have a higher quality of life. As the patient's symptom burden is decreased, it will result in improved function. If you have a topic that you would like discussed or a question that you would want answered, please leave those along with any helpful additions for others to read in a comment below. Most of the videos have timestamps within them to help you more easily find a particular discussion point or segment within each video. And remember that you can turn on the closed caption by clicking that CC button and speed the video up or down by changing your settings. I really appreciate receiving a thumbs up and the friendly, supportive remarks that you leave. You all have been very encouraging, and I am truly grateful for this has motivated me to keep making this educational content, and the channel has grown considerably. There's information here on the channel across a spectrum of topics related to patient and family needs for managing issues that arise from an illness as it progresses. There are reviews of books and literature, interviews with various members of an interdisciplinary team, discussion of symptom management methods, and didactic review of various disease states, as well as technical instruction on how providers manage difficult conversations and provide in-depth training regarding all of the life-sustaining treatment options that are available for patients to know about, as well as their healthcare surrogate. I hope that having the availability of this information allows for you to access it whenever needed, so that you could start or stop listening depending on the concerns that you have and your ability to tolerate hearing honest truths about some very difficult topics. Let's talk for a few minutes about the medical specialties of palliative and hospice medicine, as well as review some of the similarities and differences of these two aspects of care. Both of these are focused on symptom management and care of people with serious illness. Even when cure is not possible, we can always care and we can always offer healing. Patients with serious or terminal illness should never feel abandoned by a healthcare provider. These people and their loved ones need assistance and support at this time in their health journey, now more than ever before. The patient needs help for symptom management of those debilitating symptoms and the reduction of burden, and that becomes a priority for them as that disease state advances. There are many symptoms that can be addressed, and our talks will span across all physical, emotional, and spiritual aspects of a person's life. These are symptoms that can cause a person to have what we call total pain. The concept of total pain management requires a team. To tackle this comprehensive approach to care, many highly trained disciplines are required. Our goal is to improve a patient's function. We want to alleviate their symptoms that are resulting in that suffering. Many patients find that their illness has resulted in limitations, and some of the treatments for that illness have inadvertently resulted in further limiting them from daily activities, nightly sleep, and it's caused them to have reduced joy in their life. We want to reduce that suffering as much as we possibly can and improve their limitations. There is a specific medical specialty devoted to the management of this vast array of issues that comes from living with serious illness. That is the specialty of palliative and hospice medicine. This type of care can be identified by patients having a need to have optimal care in management of those symptoms. I practiced family medicine for many years near the capital city of Missouri. I was privileged to care for the strong-willed, determined population that chose me as their primary care physician. I became board certified in the specialty of hospice and palliative medicine when it became a new specialty, and that led to my professional journey where I am now, being a member of a highly integrated palliative and hospice team. Both palliative and hospice care can be provided in a variety of settings, such as hospitals, skilled nursing homes, as well as assisted living facilities, independent living centers, and an outpatient setting. But a large number of patients prefer to live in their own home, and these professionals of this specialty will support that goal. Palliative care is typically provided in an office setting for most patients. It's for any patient with a serious illness that needs professional interventions for symptom management, guidance for difficult conversations and discussions, instruction regarding what life-sustaining treatments are, what is available, and to assist them setting their personal health care goals based on the circumstances of their health. The patient and their loved one can receive information regarding the trajectory and what outcomes are probably going to look like after a treatment or after a surgery, or if administration of one of those life-sustaining treatments is required. Goal setting is dynamic and ongoing, as over time a person's health changes and we need to allow hope to change as well. Hospice is care for patients that are nearing the end of life. When a patient's disease state is advanced and it appears more likely than not the person has entered that last 6 months of life, this type of care, hospice care, is offered. Typically, hospice care is provided in the patient's home setting, as many times it's become difficult for this population to get out of the house. And when they do feel up to going out somewhere, they often don't want to waste the precious little energy that they may have going to wait at a doctor's office. Realistically, none of us want to do that, but this special population has been prioritized to have a visiting service of several highly trained disciplines that will come to their home environment to provide that care. Hospice patients receive care at no cost or very low cost, and they have access to call a nurse to come for an in-home visit to evaluate a concern at any time, night or day, weekend or holiday. That nurse will provide a report to the physician that's on call. I mean, how wonderful is that? A visiting service that you could reach any time to request a nurse to come to your home to evaluate the patient. Both palliative and hospice care also involve courageous conversations to help patients and their loved ones learn difficult truths about the disease process and its stage. There's discussion of prognosis and trajectory in these discussions. These difficult conversations will help patients and their families with planning and making preparations. The conversations are guided discussions, and we want to gently help patients and their loved ones consider what their healthcare goals are and temper that with likely outcomes. Education regarding illness, trajectory, and prognosis must include honest information and discussion of those life-sustaining treatments, and that's CPR, which is cardiopulmonary resuscitation, mechanical ventilation for respiratory support, dialysis, artificial nutrition, and blood or blood products of transfusions. Understanding more about their disease process and having open discussions regarding what their hopes are, their fears, their concerns, what are their goals of care in the face of that serious illness as it progresses. It provides a great advantage to the patient and their loved ones to learn all these facts and to better understand what it means when they elect to have those life-sustaining treatments limited. Both palliative and hospice care are focused on symptom relief. Patients with serious illness may have pain, breathing issues, bowel concerns, as well as sadness, anxiety, other mental health issues, and many will experience suffering with spiritual needs that should be addressed. The specialty of palliative medicine will address all of these issues and assist patients to have those symptoms managed better. Maybe it will help me to tell you that palliation implies symptom relief. Palliation of their symptoms while the patient continues to receive disease-directed care. Many insurances will cover evaluations of the palliative specialist and their team members. All of hospice care is focused on symptom management. At the time most patients begin hospice, curative options have often been exhausted. Hospice delivers care and assistance to address many of the same symptoms with the addition of a full multidisciplinary team. This holistic approach comprehensively addresses the patient's body, mind, and spiritual needs. Hospice care is to be offered as early as possible for patients with life expectancy anticipated more likely than not to be 6 months or less if the disease process follows the typical natural disease course. The reasoning to offer this service as early as possible is based on study results that show outcomes across many measurable metrics are improved when earlier care is accepted. Although it is understandably, unimaginably frightening to have to hear those words, I must point out that patients who act on this information early by accepting hospice care statistically outlive that prognosis. Patients making choices of what matters most to them, what sacrifices they're willing to make to have more time, and learning what that time might be like are all part of these difficult conversations. The hospice team members that visit the patient in their home living environment often and on a regular basis or as needed basis will catch disease exacerbations early and offer interventions that can prevent decompensation that might cause hospitalization. Hospice is supporting the person and their loved ones through a very difficult time. The purpose of hospice is to neither hasten death nor prolong the dying process. Nearly all people in the United States have the right to this valuable service at no charge. I want to stress that studies have proven that early intervention by palliative and hospice level care enables patients to have a higher quality of life while living better and longer than expected. The specialty of palliative and hospice medicine is not limited to one disease process or symptom. You might have thought that this only covers care for patients with cancer, but it is much broader and not limited to any particular organ system, illness, or disease process. This specialty will assist with reducing burden caused by any vascular or circulation problem or heart disease, pulmonary or lung disease, as well as liver disease, kidney disease, or neurologic diseases. Illnesses that are related to advanced age that result in the patient becoming extraordinarily frail and debilitated are also covered. This team approach will look to develop a treatment plan specific for easing a patient's symptoms, making a unique, individualized care plan for the patient, as well as working with the other physicians that may well be continuing to provide care for that disease process, causing the patient to decline. Palliative and hospice providers are sensitive that patients with serious illness often may have many symptoms that are not being addressed by the specialist that is treating that disease process. Many times specialists just have a busy schedule and they don't have the time in their schedule for the needs of the patient for those symptom management. They're treating the disease, and our specialty is to treat the patients and their symptoms. To optimize comfort-focused care, we use a team approach. Physicians and nurse practitioners mostly provide palliative care with assistance from social workers and chaplains also being part of that team. The hospice care team is required by CMS, Medicare, and insurance companies to use all of these clinicians with additional staff members of nurses, therapists, and volunteers. Having all of these members is a mandated requirement for a hospice team. This group of people works tirelessly to help patients and their loved ones during the difficult times that they're facing. Hospice teams are made up of many disciplines working together, and it's required for those agencies to employ physicians, nurse practitioners, RNs, and the licensed clinical social worker. The LCSW functions as a counselor, bereavement specialist, and they also assist with care coordination and arranging DME, as well as helping the patient find a safe care environment when the patient becomes unable to live independently or their needs have outstripped what their loved ones can provide. Another required discipline by these insurance companies and by Medicare, one that I find indispensable, is the chaplain. The spiritual needs of the patient and their loved one are addressed primarily by this discipline. Sometimes patients may jump immediately from the word chaplain and try to equate that with a pastor or religious leader. The chaplain is much more than this. The chaplain is extensively educated across a broad spectrum of many religions, and it encompasses the depth and breadth of spirituality. Also on the hospice team are LPNs, certified nursing assistants, nursing aides, volunteers, as well as many therapists. Some of the types of therapy that are provided may include physical therapy, occupational speech therapy, pet therapy, respiratory therapy, or music therapy, as well as others. The number and intensity of some of the therapy visits may be limited given the frailty of the patient, though. Also included in the hospice interdisciplinary team are likely to be pharmacists, nutritionists, and dietary specialists, among other disciplines. Care from this comprehensive group of specialists truly addresses the entire realm of concerns and symptoms that the person and their loved ones may encounter as their disease progresses. In summary, when disease is advanced, electing comfort is not about quitting or giving up, but it's about learning more and making choices about what's really important, how to utilize the time that they have remaining, how to manage the symptoms that are limiting quality of life, and to address the concerns that arise from suffering from a serious illness, as well as prepare for the changes that come when time becomes short. Having an expertly trained team that will help prepare for these changes and to be guided through how to manage difficult conversations and make hard choices is very reassuring. Helping people remain in their own home as long as possible and maintain the highest level of personal function for as long as possible is the goal of many, and that's what this team is about. Palliative care guides through those difficult conversations, gives education about life-sustaining treatments, and addresses symptom management for anyone with a serious illness, all in an attempt to reduce the burden of that illness. Hospice care is comfort-focused care and palliation of those symptoms for patients that have reached end stage of a medical illness or disease process, in the opinion of two physicians. Hospice is a comprehensive, holistic approach to care provided by an integrated team of specialists that will visit the patient in their home setting to assist the patient and the family, as that family is providing most of the patient's daily needs. During November of each year, we honor the specialty of palliative and hospice medicine. We acknowledge the disciplines and the people that provide this type of care. We take time to raise awareness and to make additional efforts to reach people that need this type of care. Families caring for a loved one with a serious or terminal illness can have help meeting the care needs of that person, assistance with the management of the symptoms that are robbing that function from a person. Thank you for clicking the subscribe button. This channel has grown so much, and it brings a smile to my face to know that in the era of artificial intelligence, there are still people who are interested in learning from another human rather than a robot. My position has always been that healthcare is a service industry where our customers are humans. I also believe that we are humans caring for humans, and we're able to and should be more sensitive and compassionate, better able to relate to one another than a bot would. All of this may change, as many things have changed significantly over the time of my career. For me, though, this still holds true, and it remains very important to me that it's all about people, caring for people, and that's what matters most. Thank you for being here. Bye now.